Hi, everybody. My name is Dr. Matt Kostura. I'm with the Emergency Services Institute. I'm one of the assistant program directors for the Emergency Medicine Residency. And today I'm going to talk about how we've incorporated simulation days into our Emergency Medicine Residency training. So we've incorporated some simulation into prior academic days, and this has been really well received. And as we transition back into in-person conferences as COVID cases have gone down, we wanted to incorporate more simulation into their resident educational content. Particularly resident training needs were in pediatric cases and critically ill cases. And we have been doing an annual airway lab at the Sim Center. So I put together this poster to talk about everything we've done with that. So the participants in these simulation days were PGY 1, 2, and 3 emergency medicine residents, as well as some med students, and each session was a total of 5 hours. So the goal of these sim conference days was to develop a mix of cases of both medically complex, common, and rarely seen pathology. We split this up into 3 core sim days, as mentioned: critical care simulation, pediatric simulation, and the emergent airway lab. Our goal overall is to add a little bit of variety to the core EM content rather than just having, lecture presentations. We like to get the residents on their feet and thinking and do some procedural competency as well. Additionally, we wanted to incorporate some interprofessional collaboration into the educational days. So let's start with the airway course. This is something we've been doing for a while, and this was kind of the basis for adding on the other courses. Essentially, the way we split it up, we do a big group lecture the week prior to the actual airway course at the Sim Center, and then the course consists of 8 stations that are hands-on. There's 4 procedurals, which you can see listed there, to try airways with different equipment, and then 4 case simulation stations for difficult airway situations where you have to pick the equipment and resuscitate the patient. And there's a picture of Dr. Hamadi doing a debrief after a bloody trach airway simulation during this past course. On one of our other simulation days, we incorporated critical care. We have actually a number of dual-boarded EM and ICU docs, and we wanted to use their expertise to run some simulation cases for critically ill patients. So it was a nice collaboration between those docs. The stations are listed down there. We did right heart failure, end-stage liver disease, a crashing COPD. We did a toxidrome, and then we did some vent basics. And that was kind of cool because we incorporated our respiratory therapists into showing the residents how to run the vent. There to the side, you see an example of one of the cases written up about the crashing cirrhotic patient. Each case has its own goals, objectives, and the various frames that we run through. And we change based on how the group is responding to the case. And then finally, for pediatric simulation, here we split the day up between a half day of simulation cases and a half day of lecture. And it was a nice collaboration between the pediatric ICU as well as community EDs. Some of the sim cases we had been using previously, myself and Dr. Jimenez do pediatric simulations with the EM attendings, and we thought these are good cases to run the residents through as well. So what were the outcomes? Well, overall, the outcomes are very positive. We had residents fill out surveys for each of the courses. You can see some of the comments there. Passionate teachers, awesome post-simulation talk, loved incorporating respiratory therapists into our learning. Of course, there's always areas for improvement, including less time on the commonly practiced stuff. The residents really like to see those rare and difficult cases, and that's something that's good for simulation because those things are often tested as well. But you see overall, they rated the course as well, and they enjoyed it. So next steps, we want to continue this going into our regular conference cadence. This is the first time we did 3 sim days, so we plan to do this again this year, hopefully incorporating more interprofessional teams, including neuro ICU, obstetrics, perhaps nursing and pharmacy as well. And then additionally, maybe bring in some of the mobile sim capabilities to actually the EM resident conference that we have once a month on Wednesdays at the Cleveland Clinic. So thanks for listening to this presentation, and I hope you enjoyed it.